All right, Dr. Berner here. Today I want to teach you about how to use your neck stretcher. So this is about 25-pound resistance, a couple of different exercises that you can do. The more often you do this, the better results that you'll get. So every day of the week is an A+ in your test. 3 times a week is a C, so at least 3 times. Again, our goal with our spine is to get us nice and straight front to back, but 3 curves on the side. We want to have the ear evenly over the shoulder when you're looking at your neck on the side. So we don't really see that much. We see a lot of this anterior head syndrome, that forward head posture, which causes the lower part of the neck, the upper back, to kind of go backward. So our goal is to obviously get adjusted so they're in the right position, but is to influence this curvature in the bottom part of your neck. Now when you use the neck stretcher, we don't want to place it underneath your skull. That's too high up. You're just going to push your neck forward. Our goal is to use it at the bottom part right here. Now, if it's a little too tight, you can loosen this up. You can also do some rear delts like this. So you just take this, go to the back. Now, how to do the neck stretcher exercise? Put this on the low spot of your neck, right down here. You see that? Now, we're not going to take it and go down. You go straight out in front of you. At the same time, my neck is going to go backwards. Controlled. Everything is done gradually. So you bring this out, bring your head back, wait about 3 seconds, and reset. Now notice my elbows are staying into my body. They're not out. You have way more strength with your elbows in. So we do this, head back. 3, 2, 1. You start getting dizzy, symptoms get worse, a flare up, take a break. Let me know right away if this is causing problems for you. You want to do this at least 15 to 30 reps a day. Should take you about 5 minutes to do. That's a television commercial. There's always time for that. So again, we take it out, bring the head back. 3 seconds, reset. Straight out in front of you. We want to take the spine that's going forward like this. We put that stretcher down at the low spot of the neck and we bring our neck back. This is how we can influence that curve, improve circulation, decrease our symptoms, and get the best results possible. So Dr. Berner, Foundation Chiropractic, how to use your neck stretcher.